This video is on the muscular system and specifically the lower extremity. Alright, so let's start out with our anterior thigh muscles. So we're going to start by drawing our different bones out first. Obviously this is going to be an anterior view, but I'm first going to start with a more superficial view of those anterior thigh muscles, and then we'll move to the deeper view. So I'm going to first, let's see, I'll draw a pelvis. And then we're gonna have our femur here. And then I'm gonna add in some vertebrae. And they wouldn't actually be that close together. There would be discs in between, but I'm not quite going there at the moment. So here's just like a little bit of a half of a pelvis. Alright, so I'm gonna ignore like the posterior part of the pelvis and just start drawing our femur. Again, these aren't going to be extremely detailed like we did in the bone lectures, but it'll be good enough for us to be able to tell where kind of bones are sitting. So here's going to be part of our tibia here, and then part of our fibula, and that's all we need actually. So last part is our patella in there. So here's our base for our anterior thigh muscles. Now, the first muscle we're going to draw is our iliacus muscle. You can also, I've heard it's pronounced iliacus. You can say whichever one you like, but iliacus is more common. So for this specific muscle, it starts at the ilium within the iliac fossa, like right here. And then it goes and it attaches to the lesser trochanter of the femur. Now again, we don't need to know the specific places that it attaches at this point for this course, but it's just helpful in knowing where those, the places where it attaches, because it kind of, you know, it helps kind of clarify things for us in general. So sometimes there's a little bit of attachment onto the sacrum as well, but for now I'll just draw it onto the ilium, and then it's going to kind of attach just like that. So I'm going to make it a little bit thicker just so it's super clear here. There we go. And that's our iliacus. Now for this class, I don't need us to know the specifics. I just want us to know that it is like very many of the anterior thigh muscles, it's innervated by the femoral nerve, and it serves to flex the hip. Now there's another muscle that's pretty closely related that also flexes the hip. It's not innervated by the femoral nerve, but they kind of act like a unit. So we have our psoas major and minor. So that's going to be our next one. Sometimes it's just called psoas, and I'm kind of grouping major and minor together. Now for psoas major, it goes from all of these like lumbar spine vertebrae, and then there should actually be one more up there, but it won't fit in this picture. And then it goes and it attaches to the lesser trochanter as well. So it's going to come right in here. And as you can see, they kind of attach together. So as a unit, this is called iliopsoas. So we kind of combine both muscles because they play an important role in flexing the hip. Okay, so that kind of incorporates psoas minor and major. Now, our next muscle is sartorius. So do you remember when we were learning about the spine about the pelvis, that we talked about a couple of specific landmarks, our anterior superior iliac spine and our anterior inferior iliac spine? Well, the origin of sartorius is actually on the anterior superior iliac spine, and it goes down and it attaches to a place on the medial tibia called pes anserine. Now we're going to have a few different things attached to pes anserine, so I'm just going to mark that for us. You know, it's one of those things that I'm going to mark that isn't quite a muscle, but it's important for us to note. So I'm just going to put a little yellow mark and say pes anserine. What that actually means is goosefoot. And the way that 3 different muscles attach there makes it look like a goosefoot. So that's just a little side note. But let's get back to our sartorius muscle. So it's going to come kind of across the femur here and attach there. It's a small muscle, and it's going to be the one that's most superficial when you're looking at the model. So keep that in mind. It's going to be like this diagonal muscle right towards the surface. Just making it a little bit darker. So that is our sartorius. And that's innervated by the femoral nerve as well, but we don't need to know the action because it's a pretty minor muscle. So let's just leave that out for now. Our next muscle is our tensor fascia latae, and that muscle, it goes from part of like the iliac crest region. So let's start drawing that in. So it'd be like from right here. And then it's going to go and actually attach into the IT band, which is lateral. So it's gonna attach, if you've ever heard of like IT band syndrome, that's where that comes from. It's the iliotibial band. So it's gonna be a muscle kind of shaped like this. And that will be our tensor fascia latae. Alrighty, so a couple of notes about these muscles. Our iliacus and psoas, that forms that iliopsoas muscle as a whole, and it is very clinically relevant because oftentimes what happens is it has these really significant attachments to your low back and your pelvis. And so when your hip flexor muscles, the ones that flex your hip, when that iliopsoas muscle group gets tightened, especially with like prolonged sitting where you're in a shortened hip flexed position, the muscle itself will lose mobility and it'll just lose its length. So then when you try to stand up and walk around, it's going to pull on your pelvis and pull on your low back. And it's actually a source of a lot of low back pain. So that's why I'll often ask people to take breaks during class where they just stand up for a few moments and sit down, because I want to make sure that we're preventing that low back pain. Another thing is this tensor fasciae latae is often a muscle that's overused. And we should be using different muscles to stabilize our hips and our pelvis, and I can discuss more of those when we get there. But just a couple of notes about those muscles. Now, what I want us to get into next is our quad muscles. So I'm going to show you the first most superficial one, and that is our rectus femoris. So let's get into that. It's going to attach from the inferior iliac spine, and it will go down and it's going to attach into the quadriceps tendon that's going to go into the patella, and then it's going to go from there, from the patella into the, remember we talked about before that it'll either be called the patellar ligament or patellar tendon. So it's going to go down and attach there, and that's going to go into the tibial tuberosity. All right, so we're going to come from here, and it's going to form a muscle shaped like this. There we go. So that's our rectus femoris. So that is the first muscle of our 4 different quadricep muscles. Remember that we're going to always go by the name of the muscle, and quad is in the beginning of quadricep, so that tells us that there are going to be 4 total muscles. All 4 quad muscles are innervated by the femoral nerve, and they all extend the knee. So that pretty much does it for the more superficial muscles. Now let's move to the deep ones. Oh, one more thing I forgot is that the tensor fasciae latae, it abducts the hip, but we don't want it to be the prime abductor. So I'll show you one that we do want to use a little bit more, but the function of this muscle is to abduct the hip. Now let me make a note that this is more superficial. And then now I'm going to redraw things deeper. But since we don't really need very much, we don't need this whole pelvis and everything, I'm just going to start here at the femur. So we're going to have the head of the femur here going into the neck. And I'm just going to draw this out one more time. What this is going to allow us to do is it's going to allow us to look at our quad muscles, but the ones that sit deep to rectus femoris. So it'll help us kind of like fill in the gaps here. And this is our right anterior thigh, by the way. Medial, lateral, lateral, medial. Okay, so we have superficial and deep. Now we're moving into deep. So the rest of the 3 quadriceps muscles that are deep to rectus femoris, our first one is vastus lateralis. And let's see, that muscle is going to attach from kind of like up here. And then same thing, it's going to go into the patella and then down into the tibia. So this is our vastus lateralis. It's our most lateral quad muscle. That again is deep to rectus femoris. And the fun fact is actually, if you're looking at a cadaver and the cadaver is prone, you can actually see quite a bit of the vastus lateralis peeking around, and it almost kind of looks like one of the hamstring muscles instead of a quad muscle. All right, so that's our vastus lateralis, and like we said before, it's innervated by the femoral nerve and it extends the knee, just like all of the other quad muscles. Oops, I forgot to write the name down. Vastus lateralis. Alrighty, next we have our vastus medialis. So that will be from about here, again going in and down there. There's our vastus medialis. And then our last quadricep muscle, that is going to be our vastus intermedius. And that is going to go from about here and then make its way down into patella using the patella. It's going to go down into the tibia. All right, so that covers all of our anterior thigh muscles. We have the superficial and deep layers. Remember, these ones are just deep to rectus femoris. And I'm going to put a little fun star next to all of our quad muscles so we remember that these four muscles form our quad together. Now we're going to move to our medial thigh. Now we're moving to our medial thigh muscles. So let's do an anterior view, just because we can actually see them all from an anterior view. So let's do our usual. We're gonna draw a femur. And then we're actually going to also do the same thing we did in the last one, where we're going to draw the tibia as well and the fibula, because there's some attachments there. Sweet. Okay, so here's our base. Now what we have to do is we also have to include the pelvis in this because there are some attachments there. So let's finish drawing that out. Alrighty, so that's our pelvis. Now we are going to go through these in our order. We're going to start with a muscle called adductor brevis, but before we get started, all of these medial thigh muscles are muscles that are innervated by the obturator nerve, and they all adduct the hip, so that's adduct, or they bring the hip closer to midline. Okay, so let's start with adductor brevis. Okay, so it's going to go from about right here and here, and and it will go into the should be right about here. Alrighty, that is our adductor brevis. Now we're also going to have our next adductor, which is our adductor longus. And our adductor longus is basically going to be similar to the brevis. So let's draw that in. And it's going to go right about here. Now the next muscle we have is called adductor magnus, and adductor magnus is actually going to be a lot wider, and because it's wider, it's actually going to sit deep to these two muscles. So you're going to see some of it superiorly. It's actually going to attach behind here a little bit, and then it's going to go all the way down to here. So this is the entire span of adductor magnus. It's deep to adductor brevis and adductor longus, so it takes up this whole space, but it's just deep to those two muscles. So that's our adductor magnus. And then the last medial thigh muscle we have is called gracilis, and that muscle is going to come from about the same area, and it will travel down to a place that we've actually reviewed before. It's going to travel down here. And do you remember what that little section was called right here on the medial tibia? I hope you remember from what we just went over. That is our pes anserine. So we tend to make that yellow, or I mean I did last time, so I'm going to make that yellow again. But let me first label gracilis. And remember, pes anserine isn't a muscle, it's just a place where 3 different muscles attach. Alrighty. So that covers our medial thigh muscles that are all, remember, innervated by obturator nerve, and they all adduct the hip. Let's now move to our posterior thigh muscles. So I'm actually just going to split this page in half. And we're going to move on to posterior thigh. This is going to be a posterior view. So let's kind of do the same thing. Let's draw things out again. So let's see, this was our right. So we'll do our right from the posterior view as well. So let's start with our femur. and our tibia, and our fibula. Sweet. All right, so now we got our base of that. Now we just have to add in our pelvis. All right, so that's enough of our pelvis to be able to get by here. Okay, so here's our posterior view. We're going to look at our hamstring muscles, okay? So our hamstrings are composed of 3 different muscles, and they're all innervated by sciatic nerve, and they all do 2 different functions. Now, this is really one of the only things I'm going to teach that will have to know 2 different functions, but they all do the same thing. They all extend the hip and flex the knee. So let's start with semitendinosus. That's going to be our first muscle. All right, so it's going to come from our ischial tuberosity, which is, remember, that landmark on the ischium of our pelvis, down to the pes anserine. And this marks the 3rd thing that attaches onto the pes anserine. So the first thing was the sartorius, the second was a gracilis, and the 3rd is a semitendinosus. Now, I remember these 3 things because I remember the acronym SGT. It just kind of, I don't know if it's the official name for sergeant, but it makes me think of a sergeant. And so I remember sartorius, gracilis, and then the T in semitendinosus, just because sometimes people get that mixed up with semimembranosus. So anyway, that's our first hamstring muscle. Again, they're all innervated by a sciatic nerve, and they all extend the hip and flex the knee. Now our next one is going to be semimembranosus, and that's going to come from the ischial tuberosity as well, and it will go and attach onto this like medial condyle of the tibia. So it'll come from here and come down to here. So that's our semimembranosus. And then our last hamstring is our biceps femoris, and there are actually 2 different heads. There's a long head and a short head. So for the long head, it goes from ischial tuberosity, and then for the short head, it goes from, remember that landmark, the linea aspera? And then it's going to actually go to the part of the fibula and part of the lateral tibial condyle. So it's going to go from here and also from the linea aspera on the posterior femur. So that's our biceps femoris, long head and short head. So that wraps up our posterior thigh. Now what we're going to do is we're going to move into the pelvic musculature. So here's our pelvic musculature. So as the name sounds, we're going to start by drawing our pelvis. This is a posterior view. All right, so let's add in our sacrum here. And our coccyx. Oops, it's a little off center, but I think you get the gist. Now let's draw in our femur. All right, sweet, now we're rolling. Okay, so for these muscles, we're going to start with our gluteus maximus muscle, and that's going to go from, it's actually going to be like the most superficial muscle, and it's also going to be the biggest. So it's going to go from parts of the ilium and the iliac crest and the sacrotuberous ligament, actually. So it's going to basically come from here and come around here. And then it's going to attach into, part of it is going to go into the iliotibial band, and it's basically just going to be around here laterally. This is our gluteus maximus, our largest glute muscle. And remember, this is the most superficial one, so the other ones that we're going to draw are going to be deep to it. All right. Gluteus maximus. Now, we don't need to know the nerves for these, but you do need to know that the gluteus maximus extends the hip. So our next muscle is our, I'm going to make this a little bit wider because it does go up quite far here. All right, our next one is our gluteus medius. And for that muscle, it abducts the hip, and this is the muscle that we want to be using. This and the gluteus minimus actually do the same thing. They help abduct the hip, and that's what we want to be utilized rather than the tensor fascia lata that people will oftentimes overuse. So that comes from about here. Remember, it's underneath the gluteus maximus. And it will attach onto the greater trochanter of the femur. There we go. So we have our gluteus medius, which is our primary, or what we want to be using as our primary abductor. And lastly, we have the gluteus minimus, which, remember, that also abducts the hip. And that's going to come from about right here. And it's also going to go into the greater trochanter. Gluteus minimus. This is a posterior view. Alrighty, so next we have our piriformis muscle, and it actually has a pretty elaborate setup. So it is attaching from the anterior sacrum. So it's actually going to come from like right in here. from the anterior sacrum, and then it's going to come around and it's going to come and attach to the like medial aspect of the greater trochanter. The action of it is external rotator. So it's going to come across like that. It also helps to serve as a stabilizer for the hip. But that's our piriformis muscle. It's very clinically relevant as well because your sciatic nerve, oops, this should be an I, not a U, piriformis. The sciatic nerve travels directly under that muscle. So if that muscle is tight and restricted, it can irritate the nerve, just like we've talked about other muscles irritating the nerve as well. Now, the last part that I want to talk to you, or the last muscle that I want to talk to you about, is our pelvic floor muscles. Now, those are a group of muscles that kind of sit like a hammock here at the bottom of your pelvis. And there's actually quite a few muscles that incorporate or that contribute to the pelvic floor, and we refer to it as like this one big group of muscles. MM is that abbreviation for muscles, remember? And they're innervated by the pudendal nerve. And there are a few different functions as a whole for this muscle. I like to say that there are the 4 S's. So the first one is sphincteric. You have sphincters that help with bowel and bladder function. The next is supportive, so it helps support organs. The next is it stabilizes the pelvis because it actually crosses, some of them cross the sacroiliac joint. And then there's also sexual function, so they are supposed to lengthen and contract with sexual activity. Now, I actually am a pelvic health physical therapist, so I deal with these muscles quite a bit, and they're so important for so many different functions. They're important because, for example, a lot of times people have pain with intercourse, and they think that that's something that's normal, but it's actually common, but it's not normal, so it's something that can be treated. There are other things like if you pee when you cough or sneeze, or like you pee too much, so too much is any more than every 2 to 4 hours, or if you're constipated, or if you have something called like pelvic organ prolapse, where you kind of feel like your organs are kind of falling out of either like your vaginal opening if you have one, or your rectum. So those are all things that pelvic floor or pelvic health physical therapists treat, and they all involve the pelvic floor muscles. So that's just why I want you to make sure you know what the pelvic floor muscles are and what they do, so you can find all of those actions in your muscle charts and tables on the course website. Now our next step is to finish up with the leg muscles, and then we will be done with the lower extremity. Now we're on to our leg. So with this, we're going to cover our anterior and lateral leg muscles. And then we're also going to cover our posterior leg muscles. All right, so this is going to be an anterior view and a posterior view. All right, so let's start as always by drawing some fun things out. I'm going to include the distal end of the femur. So this is going to be medial and lateral. So we're also going to have our tibia here. And then our fibula. And then we're also going to have our foot. So I'm going to kind of just draw like a little blob where our tarsal bones are, just because, you know, I don't want to use our time to go into detail at this moment. And then I'm going to draw out all of our different digits in the foot, just to save us time. Okay, so now let's also draw out the posterior view. So again, we're going to have the distal end of our femur, and this time this is going to be medial, this is going to be lateral, and we're looking at someone's right leg and their right leg. Alrighty, so let's draw in our tibia. And our fibula. And then I'm actually just going to draw our calcaneus right here, and then leave the rest of the foot out. Or you know what, it might help us. To have some other things in here just for reference. There we go. So here's our posterior leg. So this is, we're looking at the plantar surface of the foot, and here we're looking at the dorsal surface. So let's get started with our muscles. The first muscle we're going to draw is part of the anterior leg, and it's called tibialis anterior. Now this is a very, very clinically relevant muscle because it helps specifically with the action of dorsiflexion. So if you remember, that's us as if we're bringing our toes up towards our nose. Now all of the muscles in the anterior leg are innervated by the deep peroneal, also known as the deep fibular nerve. Peroneal is the old name for it, and fibular is a new name. So if you ever have someone teaching you anatomy again, if they are a little bit older, they'll probably be using the word peroneal, but if they're a little bit younger, they might be using the word fibular. Now, let's get going with our tibialis anterior. So it's going to come from the upper, like half of the lateral shaft of the tibia, and it will kind of form a structure like this, and then it's going to actually come down and go more medially, and it's going to come to the base of the first metatarsal. You don't need to know that, but I just want to share that with you just because it'll help us kind of understand the action of the muscle. Because if you think about these fibers shortening, it will bring the foot into dorsiflexion. And as always, these muscles have different functions as well, but we're just talking about the main one here. So this is tibialis anterior, very important for dorsiflexion. We need to make sure that that muscle is working so we don't have something called like drop foot, where our toes drop towards the ground and we can trip over them because we can't lift them up when we walk. Alrighty, so that's our tibialis anterior. The next muscle we're going to learn is extensor digitorum, and we're going to kind of combine extensor digitorum longus and extensor digitorum brevis. So it's going to come actually from the fibula up here. And then, so that's where the extensor digitorum longus comes from. And you also have extensor digitorum brevis, but we're going to kind of group them. And what's going to happen is they're going to go down and attach into the lateral four toes. Remember how we had the forearm muscles that would often attach just into the lateral four digits other than the thumb? Well, this is the same case. It's going to attach into everything other than the big toe here. And what this muscle is going to do is it's going to extend all these four toes. All right, so that is our extensor digitorum longus and brevis. Our next muscle is extensor hallucis longus. And remember, whenever we're talking about hallucis, it's always going to refer to the big toe. So that's going to come from like a little bit more of like the fibula area, and it's going to attach into the distal phalanx of the great toe. So it's going to come right in here, and it'll come from like the middle half of the anterior fibula. So it's actually going to come all the way across like so. There we go. That is our extensor hallucis longus. All right, now you have a bunch of other foot muscles, just like you have a bunch of other hand muscles that we're just not going to go over at this point. We're just going to go for these major ones. Now that does it for anterior leg muscles that I want you to know, but we're also going to cover one group of lateral leg muscles that we can see from this view. Okay, so we're going to cover our fibularis, longus, and brevis. And remember how we talked about the anterior leg muscles being innervated by the deep peroneal or deep fibular nerve? And the word peroneal or fibular is interchangeable. Well, that's the same way for these lateral leg muscles. It could either be called fibularis longus and brevis or peroneus longus and brevis, depending on who you're talking to. So it's going to come from the like upper 2/3 of the fibula. So it will come from about here. And what's going to happen is it's actually going to come underneath the foot. So it's going to come down behind the lateral malleolus and come like underneath the foot. And it'll go and attach on the plantar aspect of some of these toe of like the first metatarsal and stuff like that. So I'm just gonna, you should be able to see it like traveling through and underneath the foot. We just can't see it because it's the anterior view right here. So that's fibularis longus, and then brevis will do something similar. It's just gonna come from a little bit lower, and it'll attach on the base of the fifth metatarsal. So both of them together kind of attach to the base of the fifth as well as the base of the first, and also that happens attached to like medial cuneiform here. So just know that we talk about them as a group in this course. So fibularis, also known as peroneus longus and brevis. And this is the one that starts along the fibula and then comes underneath the foot and crosses on the plantar surface. Now, these muscles here, the first three of the anterior leg muscles, those are innervated by our deep peroneal or fibular nerve. But the fibularis or peroneus longus and brevis, this last one here, is innervated by the superficial peroneal or superficial fibular nerve. And what, you know how we talked about the extensor hallucis longus, like that extends the big toe? Well, the fibularis longus and brevis, they together evert the ankle. So if you don't remember what that is, go back to our lecture where we discussed the movements so you can look at what foot eversion is. Okay, so last but not least, we're going to go to our posterior leg muscles here, and we have two to cover. Our first one is gastrocnemius, and these are both basically your calf is what they make up. So your calf has two different heads. So it's going to come from the medial condyle. right here, and then it's also going to come from the lateral condyle right here. So what's important about this is the muscle that it actually crosses the knee joint because it attaches to the femur. And then it's going to make its way into the Achilles tendon that's going to attach into the calcaneus. So it's going to be kind of shaped like this. And they're going to be the two heads. So let me just color that in a little bit more so we can see it better. And for these two calf muscles, your gastrocnemius is going to be the one that's more superficial. And the next one that we're going to learn, called soleus, is going to be the deeper calf muscle or posterior leg muscle. Okay? So that's our gastrocnemius with our different like medial and lateral heads there. Both of these muscles that we're going to learn in the posterior leg are innervated by the tibial nerve, and they both do plantar flexion at the ankle, which is like you're going to press the gas pedal, that type of motion. Now, our last muscle is soleus, and it's going to come from part of the tibia and fibula, and then it's going to come down and attach into the Achilles tendon that's going to turn into, or attach into the calcaneus like we talked about. So let's see, it'll be from about here. Remember, this is deep to gastrocnemius, and then it'll be also towards here, and then it will go into the Achilles tendon and into the calcaneus. Alrighty, so that is our soleus, also innervated by the tibial nerve and also plantar flexes the ankle. Now this is the end of our lower extremity muscular system lecture.